Hi, my name is Mordechai Caplan, and I'll be presenting today with my classmate, Julia Benville. We are first-year medical students at Albert Einstein College of Medicine in the Bronx. We will be talking about a 2.5-hour preclinical curriculum that we are implementing in collaboration with addiction medicine faculty, Dr. Stein and Dr. Lu, and two second-year medical students, Brezel and Kaitlyn Clausell, that addresses stigma associated with substance use disorders. Here we are, and we are incredibly passionate about this project, but have nothing financial to disclose. Our project is a 2.5-hour preclinical education session for first-year medical students at Einstein that is focused on addressing stigma associated with substance use disorders and is part of the health systems and health equity course that first-year students are taking. What makes this project unique is that students were involved in the creation of this curriculum every step of the way. We developed this because deaths from overdose have been steadily rising in the US. Here in New York City, one person dies every 4 hours from a drug overdose. When looking at the number of overdose deaths by borough, the Bronx, where Einstein is located, has been disproportionately affected for many years, with the highest overdose death rates of any New York City borough for the past 2 decades, including the first half of 2021. Despite this high burden of overdose mortality, disparities in substance use disorder treatment are all too prevalent. There is relatively low utilization of buprenorphine treatment in the Bronx compared to other boroughs. The lack of access to care reflects the healthcare barriers, and a key one of these barriers is stigma. Stigma exists on 3 levels. There are structural or societal, public or interpersonal, and self or individual. What we have control over and are targeting for this project is public stigma perpetuated among physicians. Stigma towards people with substance use disorders is a national problem, in particular from healthcare providers, and can contribute to treatment disparities, and therefore addressing stigma in medical education is one way to work towards health equity. The negative attitudes that healthcare professionals had towards patients with substance use disorders were commonly attributed towards inadequate education and training about substance use disorders. This can be seen early on in medical training from a survey that was done on first-year medical students that found that even though they had adequate knowledge about substance use disorders, they still viewed the patients as irritating and difficult to work with. The labels that we use are also problematic, as was seen when labeling a patient as a substance abuser as opposed to having a substance use disorder changed how mental health clinicians viewed them and caused them to attribute more blame on the patient.
Our work builds on previous projects various academic medical centers have implemented, including curricula and assessment for basic knowledge about substance use disorders and the stigma associated. Our program, however, is unique in that it aims to add to medical students knowledge, skills, and attitudes specifically about the stigma associated with substance use disorders and people who use drugs. We're adding a further dimension to past research by evaluating the impact of our curriculum on these domains. We are using the medical condition regard scale for attitudes and 2 independently developed scales for knowledge and skills. Here we have our learning objectives, which are focused on the impact of stigma and actively learning person-first language in medical contexts. Our curricula is broken down into 5 components. First, self-directed pre-work reading on health-related stigma. Second, a background lecture on stigma structures. Third, a panel of persons with lived experience. Fourth, an active learning session to rewrite medical documentation without stigmatizing language. And fifth, an evaluation between pre and post session assessing knowledge, skills, and attitudes of working with people who use drugs and with substance use disorders. We are collecting data currently comparing our pre and post surveys. We expect to see an improvement in knowledge, skills, and attitudes. The informal feedback was incredibly positive, and we look forward to analyzing the data soon. We want to give a very special thank you to our faculty advisors, Dr. Tiffany Lu and Dr. Melissa Stein, who have helped us immensely with this presentation and guided us in the development of the curriculum. We would also like to thank SAMHSA as our funder. Thank you.